12 indicators of your health from your feces. You can learn a surprising amount about your internal health from your bowel movements. Everything about your digestive system, and hence your general health, may be deduced from its color, consistency, smell, and regularity. While this may seem strange, studies have connected altered bowel habits to serious health risks, such as colorectal cancer, the third most frequent cancer globally. Surprisingly, alterations in feces can frequently reveal early indicators of such serious illnesses, making it a silent yet useful health monitor. We'll discuss 12 different poop colors and forms in today's video, along with the health implications of each. However, how can someone ensure a healthful bowel movement? Watch the entire video, and we'll walk you through it. First, though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. 1. Brown color. Our feces' brown color is an interesting sign of a healthy digestive system, with bilirubin being the main player in this organic process. Bilirubin is a consequence of our body's aging and deteriorating red blood cells. The liver subsequently processes this material, changes it, and secretes it as bile. To aid in the breakdown of lipids, bile, an essential digestive fluid kept in the gallbladder, is discharged into the intestines. Bilirubin is further transformed by intestinal bacteria as it passes through the digestive tract, giving rise to the brown pigment that provides our stool its color. This voyage emphasizes the body's effective waste management system and the need of preserving the health of the liver and gallbladder for appropriate digestion and waste removal. In order to eliminate bilirubin and other waste products, a diet high in fiber, such as fruits, vegetables, legumes, and whole grains, helps regulate bowel movements. While guidelines for appropriate dietary fiber intakes vary by region and age group, it is generally accepted that people should consume 25 to 30 grams of fiber per day or more. Second, green feces. Despite the fact that it is often unexpected, green poop can be caused by the digestive system as well as food choices. Eating meals high in chlorophyll, such as leafy green vegetables like spinach, kale, and broccoli, is the first step toward having a green stool. If you consume substantial amounts of these foods, the chlorophyll may cause your stool to appear green. The speed at which food passes through your digestive tract is another, less obvious route. If you eat too quickly, your liver breaks down bilirubin too rapidly. Bilirubin is a yellow-green protein that gives healthy stool its brown color. This could lead to green feces, which is an indication that digestion is occurring more quickly than usual, possibly as a result of diarrhea or a malabsorption problem. Focusing on food that support digestive health may be helpful for people whose digestive tracts are transiting quickly. Foods high in probiotics, such as kefir, yogurt, and fermented veggies, may improve intestinal health. Third, yellow excrement. Yellow poop is caused by a mix of factors, including dietary decisions, particularly the consumption of high-fat foods, as well as disorders that impact fat digestion and absorption. Food is given a greenish tint by bile salts from the liver, which are broken down by gut enzymes as it passes through the digestive system. A lighter yellowish look may occur from this color change being prevented by the presence of extra fat in the feces as a result of malabsorption problems such as celiac disease. Because of this malabsorption, fats are not properly absorbed in the small intestine, but are instead expelled along with the stool, giving it a yellow color. Similar to green feces, yellow poop may also result from a fast transit time in the gastrointestinal tract, which prevents the bile from fully breaking down. Furthermore, a diet high in foods containing yellow or orange colorants, such as carrots, sweet potatoes, and yellow artificial coloring, may also lead to this color change. Adults should strive for a fat intake that is in line with healthy dietary requirements, which is normally between 20% and 35% of total calories from fat. Unsaturated fat sources, such as avocados, nuts, and olive oil, should be prioritized. 4. Black or tarry stool. Melena, the medical term for black or tarry stool, is a specific and frequently dangerous disorder of the digestive system. The presence of digested blood as it passes through the digestive tract is the main cause of this color shift. As it passes through the intestines, blood from the stomach or upper small intestine is exposed to digestive enzymes and microorganisms. By the time the blood is expelled, this exposure leads it to turn black, giving the stool a tarry look and an unpleasant smell. Black tarry stools appear if the upper gastrointestinal tract loses more than 100 milliliters of blood. A few other items that may contribute to black stools include iron supplements and drugs that contain bismuth subsalicylate, which can also darken the stool. Limiting the consumption of irritants like alcohol, caffeine, and spicy meals may lower the risk of GI bleeding in people who are vulnerable to ulcers or gastritis. It's crucial for those taking iron supplements to adhere to the recommended dosage and not go over it. Fifth, red feces. The most obvious and safest causes of crimson stool are dietary variables. You may momentarily turn your feces crimson by eating foods high in red pigments, such as beets, cranberries, red food coloring, or tomato-based goods. Usually innocuous, this hue shift goes away after the food has fully passed through your digestive system. Nonetheless, if there is no food reason for the red stool, it could be a sign of hematochezia, or blood in the feces. Usually, the lower gastrointestinal tract, which includes the colon, rectum, or anus, is the origin of this bleeding. Hemorrhoids, anal fissures, diverticulitis, inflammatory bowel disease, or colorectal cancer are among the possible causes of this kind of bleeding. Unlike with black stools, the blood in these situations has not been broken down and is still red. Pus, mucus, and blood were discovered in the feces of 40 children who had bacterial diarrhea in a research. Reducing the amount of red-colored food consumed could aid in differentiating between possible bleeding and red stool caused by diet. In addition to treating any underlying medical conditions, prompt detection and treatment of gastrointestinal bleeding can avoid consequences. Sixth, pale or clay-colored stool. Poop with a specific color, such as clay or pale, frequently indicates problems with the bile duct system. The fluid called bile, which is made by the liver and kept in the gallbladder, is essential for the digestion of fats and gives stools their typical brown hue. Stool color may change to a lighter shade if there are obstructions in the bile ducts due to gallstones, inflammation, or tumors. Furthermore, diseases like cirrhosis or hepatitis that affect the liver itself might reduce bile production, which results in lighter-colored feces. In addition, patients with hepatocellular jaundice may have a shift in stool color to clay as a result of reduced bile excretion as their liver function declines. Crucially, if a patient with jaundice tests positive for blood, it may indicate serious conditions such as pancreatic cancer or adenocarcinoma of the ampulla of Vater. Antioxidant-rich diets including whole grains, fruits, especially berries, and vegetables may help shield liver cells from harm. Limiting alcohol in foods high in saturated fats is also essential to avoid gallstones, which can impede the flow of bile and liver damage. 7. Arid, hard feces. Hard stools are a widespread problem that many people encounter and are frequently indicative of constipation. This disorder arises from feces losing more water than usual due to its excessively slow transit through the digestive tract. The longer the feces stays in the colon, the more water is absorbed by the large intestine from the waste material, which causes the stool to become dry and hard. Bowel movements become difficult as a result of this procedure, which may cause pain or discomfort. A low-fiber diet, dehydration, inactivity, some medications, and ignoring the urge to go to the bathroom are some of the variables that cause this long transit time and hardening of stool. Increase your fiber intake if you have constipation so that your stool has more body and is easier to pass. Staying hydrated is just as vital. The recommended daily intake of water from all beverages and foods is approximately 4 liters for males and 3 liters for women. This helps to maintain soft stool. 8th, watery, loose feces. The term diarrhea refers to loose, watery stools that happen too quickly in the digestive tract for the colon to properly absorb water. Diarrhea is caused by either the production of fluid into the intestines or the blocking of fluid absorption, both of which lead to increased liquid content in the stool. The body may also attempt to eliminate the invading organisms in the event of an illness by accelerating bowel motions, which might lead to loose stool. Acute diarrhea is defined as a sudden increase in the number of bowel movements, specifically 2 or more per day for a duration of fewer than 15 days. This quick transit could be caused by a variety of conditions, including intestinal lining irritation caused by bacteria, viruses, or parasites. Diarrhea can also result from food allergies or intolerances, such as celiac disease or lactose intolerance, which cause an abnormal reaction in the digestive tract. Furthermore, some drugs, such as antibiotics, might upset the normal bacterial balance in the stomach, resulting in loose stools. Easy-to-digest foods, such bread, bananas, rice, and celery, also known as the brat diet, can help control diarrhea by supplying nutrients without overstimulating the digestive system. 9. Presence of mucus. Small amounts of mucus in our feces are actually a typical part of the digestive process. Mucus is secreted by the intestines to aid in lubricating the colon's lining and promote easy stools passage. Additionally, this mucus is essential for defending the intestinal walls against bacteria and other pathogens, which helps the body's defense mechanism in the digestive system. On the other hand, an abundance of mucus could be a sign of a number of gastrointestinal disorders. Bacterial infections, irritable bowel syndrome, and inflammatory bowel illnesses like Crohn's disease or ulcerative colitis may be the source of this overproduction. In addition, proctitis could be the cause. It is an inflammation of the rectum lining that might linger for a short while or a long time. The most typical symptom is an intense and frequent need to go to the bathroom. 10. A strong, unpleasant stench. The strong odor associated with human feces is a normal byproduct of the digestive process. It's mainly caused by the digestive system's breakdown of food and the activity of gut bacteria. When we eat, our food is broken down into its component parts in the stomach and intestines, creating chemicals and gas as byproducts in the process. The smell of stool is partially caused by these gases, which also include carbon dioxide, hydrogen, sulfide, and methane. Through fermentation, microorganisms in the large intestine break down undigested food, especially proteins and sulfur-containing meals, which intensifies the stench. Some vegetables, like broccoli, cabbage, onions, and garlic, emit sulfur fumes during digestion, which can cause certain foods to smell stronger than others. A greater stench may also result from eating a lot of meat or fatty foods, as fats are more difficult to digest and create more fermentation, which heightens the odor. You can reduce this risk by consuming such items in moderation. If you notice a consistent shift in the odor of your watery, foul-smelling stool overnight and it cannot be connected to your diet, you may have food poisoning. In that instance, speaking with a healthcare professional is recommended. 11. Consistency of feces changes frequently. Because IBS affects how the gastrointestinal tract functions, it has a major effect on the consistency of stools. Abdominal pain, bloating, and changes in bowel habits are among the symptoms of irritable bowel syndrome, IBS, which lacks a known biological cause. Normally, food is moved through the digestive tract by the coordinated contraction of the intestinal wall muscles. Irritable bowel syndrome might cause these contractions to become irregular or excessive. Stronger and longer contractions may cause diarrhea by pushing food through the intestines too quickly, preventing water absorption and causing loose stools. On the other hand, constipation may result from weak contractions or delayed food transit, which can absorb too much water from the stool and make it difficult to pass. Furthermore, anxiety and stress may affect gut health and change the consistency of stools. Because of its sensitivity to emotional and psychological tensions, the gut is frequently referred to as the second brain. This can cause changes in stool consistency by either speeding up or slowing down digestion. 12. Pencil-thin poop. Poop that is pencil-thin might be a worrying symptom since it frequently indicates a colonic constriction or blockage. In this case, the digestive process itself doesn't really change. The stool's shape is changed by the colon's physical constriction or blockage. The final look of the stool, as it leaves the body, is altered by the restriction, even if the body makes an effort to digest and expel waste normally. Many illnesses, such as benign polyps or inflammation from conditions like ulcerative colitis or Crohn's disease, can cause such a constriction. These disorders may result in the colon's or rectum's walls swelling, narrowing, or developing growths, which would lower the diameter of the pathway for feces. Given that stringy stool is a sign of colon cancer, some people may become alarmed upon discovering this symptom. 22% of 628 people over 40, with symptoms such as anemia, rectal bleeding, or a change in bowel habits that persisted for more than 4 weeks, were diagnosed with colorectal cancer. Stringy stool and other colon cancer symptoms may be caused by non-cancerous illnesses, including hemorrhoids and IBS, according to the American Cancer Society. It's evident that our bowel movements are more important than we may have first believed. While being aware of the 12 different hues of excrement could help us make wise health-related decisions, recalling that self-diagnosis has its limitations is essential. It is not only advised, but absolutely necessary to seek medical attention if you observe long-lasting or notable changes in your bowel habits. It's important to recognize the value of expert guidance when interpreting bodily signals, even from something as seemingly insignificant as excrement. We learned today about the many health implications of our feces. From now on, will you be observing your stool? Tell us in the space provided for comments below. We truly hope you will consider subscribing to our channel if you like this video. For you, it's a little step, but for us, it's a big boost. Bye from Radiant Life.